In thinking about sort of the take-home messages so far, we've been doing our baseline data gathering to get an understanding of how much room there is to improve in the community. So looking at health literacy and the extent to which people are indicating there really is a need for change in their interactions, their healthcare providers. The first part we talked about was the extent to which people are encountering barriers for even making it into their visits with their healthcare providers, what barriers we can help them with. Really the easier barriers to surmount are things like significant number of people just forgot to go to their appointments. That's something that can be approached pretty easily. And there's also transportation issues as well as cost issues. There were several different things that we're going to be working on and trying to see if we can do something about. And then there was how the interactions with the healthcare providers are going once they do go in, the extent to which the healthcare providers are having patients be a part of deciding what their healthcare plan is going to be. So do they come away with an actual exchange of information, or do they come away not really knowing what they're supposed to be doing next? This was a baseline assessment that tells us where things are right now, and then as the program continues to do interventions to help the community alike learn to be their own advocates, they need to tell their providers when they don't understand something. They need to express themselves to their providers and let them know what's really wrong. And then on the other end, we're working with the providers to help them to understand the extent to which the patients are not feeling like they're being engaged, and help them to change from the other side how the encounters happen, and to make sure that communication and literacy is addressed. If you're from a rural, underserved, really if you're from a community where you haven't received the same education, encouragement, or even feeling empowered to address your own health care, then there's less likelihood that you're going to. And so when your health is poor, you're more likely to just accept it and not worry about it. When you go in to get care, you're less likely to expect quality of care. And people tend to get what they expect, and rarely much more than what they expect. And so if you can't be your own advocate, then the quality of care you're getting is going to be much less than it would for someone who is. The idea is that even though we're battling structural racism and we're battling historic distrust of care providers and all sorts of things that put our communities at a disadvantage, there's still an opportunity to do something about it, to empower ourselves so that we can get the best care possible, and then in the end have the highest quality of life possible.